We begin our study of the skull with its external anatomy. In this video, we will survey the outer surfaces of the cranial and facial skeleton using the classical anatomical views known as normae. These include the anterior, lateral, posterior, superior, and inferior perspectives. Each view highlights specific bones, sutures, and surface features that together form the architecture of the skull. Our purpose here is to gain a clear and organized understanding of the external contours, borders, articulations, and identifiable landmarks. We begin with the anterior aspect of the skull, known as the norma frontalis. When observing the skull from the front, the most prominent structure is the frontal bone, forming the forehead and the superior boundaries of the orbits. The frontal bone presents a smooth convex surface, gently curved from side to side and from superior to inferior. Near the midline, the low rounded prominence known as the glabella projects slightly forward. Above this level, subtle elevations called the superciliary arches may be seen, forming the brow ridges. Below the frontal region lie the orbits, which appear as bilateral openings with a roughly quadrilateral outline. Each orbit is bordered superiorly by the supraorbital margin of the frontal bone, which is sharply defined. Along this margin, typically toward the medial third, there is either a notch or a small foramen, the supraorbital notch or foramen. The lateral boundaries of the orbits are formed primarily by the zygomatic bones, which make up the prominence of the cheeks. The zygomatic bone articulates superiorly with the frontal bone through the zygomatic-frontal suture, clearly visible in this view. The zygomatic bone extends laterally and slightly posteriorly, forming part of the zygomatic arch, though the arch itself is more fully appreciated from the lateral perspective. Inferior to the orbits lie the maxilla, which constitute the central portion of the facial skeleton. The maxilla presents the infraorbital margin above and is marked below this margin by the infraorbital foramen, commonly seen in this anterior view. The maxillae meet each other in the midline at the intermaxillary suture, although its full course is more readily observed from inferior aspects. At the midline between the orbits and above the nasal opening is the nasio, a point located at the junction between the frontal bone and the paired nasal bones. The nasal bones themselves form the bridge of the nose. They are small, rectangular bones that articulate superiorly with the frontal bone via the frontonasal suture, laterally with the frontal processes of the maxilla and with each other at the midline. Below the nasal bones is the anterior nasal aperture, a pear-shaped opening that forms the entrance into the nasal cavity. Its boundaries are defined superiorly by the nasal bones and laterally and inferiorly by the maxillae. Continuing inferiorly, the maxillae contribute to the upper dental arch, but the teeth themselves are not considered part of the skull. The mandible, although an important skeletal element, is the only movable bone of the skull and is often studied separately. In the norma frontalis, only the superior border of its body and the arrangement of the mental region may be visible. Sutures visible in the norma frontalis include the frontonasal suture, the paired nasomaxillary sutures, the zygomaticomaxillary sutures, and the zygomatico-frontal sutures. Together, they outline the principal articulations between the frontal, zygomatic, nasal, and maxillary bones. When stepping back and viewing the whole anterior skull, the overall composition becomes clear. The frontal bone forming the superior frame, the orbits positioned centrally, the nasal skeleton occupying the midline between them, the maxillae supporting the midface, and the zygomatic bones projecting laterally to give breadth to the facial contour. Viewed from the side, the skull displays one of its most comprehensive and structurally layered aspects, the transitions between the temporal and facial regions, and the articulations that link the bones of the neurocranium and viscerocranium. The major elements seen here include the frontal, parietal, temporal, occipital, sphenoid, zygomatic, and maxillary bones, The upper region of the lateral aspect is formed predominantly by the parietal bone, whose broad convex surface arcs smoothly across the side of the cranial vault. Its anterior border meets the frontal bone at the coronal suture. Posteriorly, the parietal bone articulates with the occipital bone through the lambdoid suture, descending in an oblique direction toward the base of the skull. In certain cases, small, irregular extra bones known as ossa suturalia can be found within the sutures. Inferior to the parietal bone lies the temporal bone, comprising several distinct parts. The squamous part forms a thin, plate-like region that contributes to the lateral wall of the cranium. From the lower margin of this squamous plate extends the zygomatic process of the temporal bone, a horizontally oriented projection that courses anteriorly to meet the temporal process of the zygomatic bone. Their union forms the zygomatic arch, a prominent bridge that defines the lateral contour of the midface. The tympanic part of the temporal bone surrounds the external acoustic meatus, which appears as a circular opening on this lateral surface. Posterior and inferior to the meatus is the mastoid part of the temporal bone, identifiable by the downward projecting mastoid process. Just anterior and slightly medial to the mastoid process is the slender styloid process, though depending on the angle it may be partly obscured. Posterior to the mastoid region, the temporal bone meets the occipital bone through the occipitomastoid suture, which can be followed downward toward the foramen magnum. Anteriorly, the frontal bone extends laterally to form the superior and lateral margins of the orbit. Its articulation with the zygomatic bone is defined by the zygomatico-frontal suture. The zygomatic bone forms the prominence of the cheek and contributes to the lateral orbital wall. Its temporal process extends posteriorly to meet the zygomatic process of the temporal bone, completing the zygomatic arch. In this view, the sphenoid bone is represented by the greater wing, a broad, flattened plate situated between the frontal, temporal, and parietal bones. It forms part of the temporal fossa, a shallow depression on the side of the skull. A significant component of the norma lateralis is the mandible, the only movable bone of the skull. Its ramus is visible prominently, rising vertically from the body. The superior portion of the ramus divides into two processes, the coronoid process anteriorly and the condylar process posteriorly. The condylar process terminates superiorly in the head of the mandible, which participates in the temporomandibular joint. This joint is formed by the articulation between the mandibular head and the mandibular fossa of the temporal bone, located just anterior to the external acoustic meatus. The sutures visible in the norma lateralis include the coronal, lambdoid, squamosal, sphenoparietal, sphenosquamosal, frontosphenoidal, zygomatico-temporal, parietomastoid, and occipitomastoid sutures, which concludes the lateral view of the skull. When the skull is viewed from behind, the dominant structure is the occipital bone, forming the posterior portion of the cranial vault. The occipital surface presents a broad, gently curved expanse that slopes downward and inward toward the foramen magnum, though the opening itself is not visible in this view. At the center of this posterior aspect is the external occipital protuberance, a midline elevation that marks the most prominent posterior point of the skull. From this prominence, a faint ridge known as the external occipital crest descends inferiorly toward the region of the foramen magnum. Although the crest becomes more pronounced toward its lower extent, only its upper segment is typically seen from the strict posterior view. Extending laterally from the external occipital protuberance on both sides are the superior neutral lines. These lines curve outward in a smooth arc. Inferior to them, though often less distinct from this angle, lie the inferior neutral lines, which run in a similar but shorter and lower trajectory. Framing the occipital bone superiorly are the paired parietal bones, which are visible in the upper portion of the norma occipitalis. Their articulation with the occipital bone is defined by the lambdoid suture that forms an inverted V-shaped outline across the back of the skull. The junction of the lambdoid and sagittal sutures, the lambda, can be appreciated along with a prominent emissary vein. Inferiorly and laterally, the occipital bone meets the temporal bones at the occipitomastoid sutures, situated just medial to the mastoid regions. Portions of the mastoid processes themselves may be seen projecting downward and laterally from beneath the posterior edge of the temporal bones. The overall outline of the norma occipitalis forms a smooth, broad curve superiorly, narrowing slightly as it descends. When the skull is viewed from above, the overall impression is that of a broad, gently curved dome. This superior perspective is known as the norma verticalis, and it reveals the configuration of the cranial roof, composed primarily of the frontal bone, the paired parietal bones, and a portion of the occipital bone. The most prominent feature visible from this view is the central articulation between the two parietal bones, the sagittal suture. Running along the midline from anterior to posterior, it divides the cranial vault into symmetrical right and left halves. This suture is typically serrated and forms the longest midline joint on the external skull. At the anterior extent of the norma verticalis lies the frontal bone, which contributes to the superior portion of the forehead and curves upward to meet the parietal bones at the coronal suture. The coronal suture runs transversely across the skull, forming a nearly straight line that separates the frontal bone from the parietal bones. Its course defines the anterior boundary of the cranial roof. Posteriorly, the parietal bones meet the occipital bone at the lambdoid suture, which extends laterally and downward from each side of the posterior midline. The inferior view of the skull, the norma basalis, presents the most intricate external surface. It reveals the structural components of the hard palate, the posterior nasal region, the sphenoid and temporal architecture, and the large opening of the foramen magnum. Beginning anteriorly, the hard palate forms the front portion of this inferior surface. It is composed primarily of the palatine processes of the maxilla, which meet along the midline at the intermaxillary suture. Posterior to these lie the horizontal plates of the palatine bones, joined to one another at the interpalatine suture, and anteriorly joined to the maxillae at the palato-maxillary sutures. Together, these structures form a broad, smooth surface that constitutes the roof of the oral cavity. At the posterior edge of the hard palate are the posterior nasal apertures, which open into the nasal cavity. These apertures are bordered medially by the vertical vomer, laterally by the medial pterygoid plates, and superiorly by the body of the sphenoid bone. The vomer extends upward from this view toward the sphenoid, although only its inferior margin is fully appreciated here. Posterior lies the body of the sphenoid bone, from which two notable projections descend. The pterygoid processes, each consisting of a medial and a lateral pterygoid plate. The medial plates are thin and vertically oriented, positioned close to the midline, while the lateral plates are broader and extend more laterally. The interval between these plates forms a vertical recess known as the pterygoid fossa, although its depth is not fully visible from this angle. Moving outward and posteriorly, the inferior surface reveals the complex landscape of the temporal bones. Immediately lateral is the infratemporal surface of the greater wing of the sphenoid bone. Slightly posterior to this area lie several foramina belonging to the sphenoid. Oval foramen, an oval-shaped opening positioned posterolateral to the lateral pterygoid plate. Foramen spinosum, located just posterolateral to the oval foramen, and generally smaller and more circular. Foramen lacerum, situated medially and anteriorly adjacent to the apex of the petrous temporal bone. From this inferior perspective, it appears as an irregular gap bordered by the sphenoid, temporal, and occipital bones. The temporal bone presents several landmarks in the norma basalis. The most prominent is the mastoid process, a rounded projection located posteriorly and laterally. Anteromedial to the mastoid process lies the styloid process, a slender, pointed, bony projection. Between the styloid process and the mastoid process is the stylomastoid foramen, a small but distinct circular opening. Anterior to the styloid process, on the inferior aspect of the petrous part of the temporal bone, is the carotid canal, visible as a round opening directed anteromedially. Its internal curvature is not visible here, but the external aperture is clearly defined. Posterolateral to the carotid canal, the jugular foramen is seen as a larger, irregular opening, marking the junction between the temporal and occipital bones. The central and dominant feature of the norma basalis is the foramen magnum, a large oval opening occupying the midline of the occipital bone. Its anterior border is defined by the basioccipital region, which extends forward toward the body of the sphenoid. Its lateral borders include the occipital condyles, smooth, rounded prominences that project downward on either side of the foramen magnum. Posteriorly, the foramen is bordered by the curved squamous part of the occipital bone. Lateral to the occipital condyles lie the hypoglossal canals, situated within the occipital bone, though their exact orientation may vary slightly depending on skull position. Further posterior, right behind the condyle, is situated the condylar canal. In this view, at the most anterior part, the greater and lesser palatine foramen, as well as the inferior orbital fissure, are visible. This view is presented for better visualization of the hypoglossal canal. Together, these perspectives present a complete description of the skull's external form. Each view emphasizes distinct structural elements, yet all contribute to a cohesive, three-dimensional understanding of the cranial framework. This video is a product of the 3D Atlas of Neurological Surgery platform.